Well, people have known for a long time that those who work in healthcare are not always happy, and that many people are under a lot of stress. Certainly in the last 10 years or so, healthcare has become much more complicated, much more intense. Patients have more complicated conditions when they're in a hospital. They are in the hospital for shorter periods of time, and everybody is under pressure to do a good job and to get people in and out. And this has created a lot of tension. And so we've been concerned that healthcare workers of all kinds, doctors, nurses, technicians, pharmacists, are all working harder and enjoying it less. And healthcare ought to be a happy type of work. People ought to take a lot of satisfaction because we do so many good things. But too many people are not finding their work satisfying and rewarding. And so we thought it was time to look at that and see what we could do to make it better. Well, I think so. We've gotten a lot of good feedback since the report came out. It just came out a couple months ago, but we've heard from a number of people that it resonated with them, that it spoke to the real issues. Certainly at the working level, the nurses and the doctors, there's a great deal of reception. And I think there are a lot of hospital leaders that want to create the right kind of environment. One of the things that we learn and which we believe is that the most important thing in having patients find their healthcare experience satisfactory and satisfying is to have it be given by people who work there who feel that way. Well, I think the biggest obstacle is just inertia, tradition. We've always done it this way. So we're talking, as we so often do in quality and safety, about changing our way of doing things, changing our systems, changing our behavior, and change is difficult. So just sort of the resistance to change. I think what we're talking about doesn't require much in the way of extra expenditures. In fact, if you make the workforce happier and work more satisfactory, people's productivity actually goes up. So we're not talking about big costs here. We're talking about change of mindset and leadership, really. Most of all, what we need is leadership, people who are going to say that we can do this and we need to do it and help other people do it.